Welcome to baby paste bottle feeding. Today we're going to talk about allowing the baby to regulate the amount consumed by bottle. What is baby paste bottle feeding? It's a special feeding technique used to pace feeds to promote better infant organization of feeds. Originally used in the past for preterm infant populations, infants with dysfunctional suck, babies with slow weight gain or weight loss, and helping the infant who has difficulty maintaining respiratory stability during feeding. It allows self-pacing or external pacing when using a bottle to feed babies. It's good for all babies, any baby receiving anything by bottle. It makes bottle feeding closer to the physiologic norm of breastfeeding. What are the outcomes of baby paste bottle feeding? It reinforces breastfeeding if the infant is fed or transitioning to breastfeeding. It reduces the risk of overfeeding that commonly occurs with traditional bottle feeding. And it allows the baby to be content with a volume of milk that more closely meets normal stomach size while satisfying hunger needs. Why do we use baby paste bottle feeding? It mimics the normal way to feed infants. Babies are generally more upright when breastfeeding. There's no evidence for the safety of traditional methods of bottle feeding, which usually involves the baby semi-reclining and the bottle on a downward angle. It allows the caregiver to follow the baby's feeding cues, which reinforces Wick's teaching of watching for baby's cues. It reduces volume and flow confusion for breastfed babies being supplemented, what used to be called nipple confusion. When should baby paste bottle feeding be used? For all babies who receive feeding via bottle, be they breastfed or partially, or babies who are completely formula fed. It's excellent for breastfed babies that are not receiving all their feeds at the breast. It decreases the chance of mom being told she's not leaving enough for the baby. It reduces the likelihood of mom feeling that baby prefers the bottle over nursing, thus increasing the duration of pumping and breastfeeding. For all babies, it reduces overfeeding. We see less spit up because the stomach's not being overstretched. We see less vague infant formula intolerance. That leads to WIC formula lasting longer and fewer formula changes. So when should paste bottle feeding be used? Ideally for all bottle-fed babies. Less overfeeding means a decreased risk of obesity, and baby learns to respond to his own satiation cues. No more Thanksgiving dinner at every feed. This small white ball here is the size of a newborn's stomach on the day it's born. It's designed to hold about a teaspoon to a teaspoon and a half. The red ball is about the size of a ping pong ball. It's designed to hold 3/4 of an ounce to an ounce, which is the average size of the stomach on day 3 or whenever the first day of increased milk production occurs in the breastfed baby. And the egg represents the size of the baby's stomach from about 10 days on. It's much stretchier at that point. It can be overstretched if the baby's fed Thanksgiving dinner, but it's designed to hold about 2 to 2.5 ounces. Here's the picture of a dad feeding a baby using a baby paste bottle feeding technique. You can see how upright the baby is, neck and shoulders supported, and that the bottle's being held level. So what nipples and bottles work the best? Choose a bottle and a nipple that are appropriate for the infant to be fed. You want to select a bottle based on the suitability of its size, its shape, and the flow rate by observing carefully to see what works best for the baby. Generally, a straight-sided bottle rather than a bent or angled bottle works the best. If you're using a disposable bottle, choose one that uses straight-sided drop-ins rather than the liner bags. And here's a bottle using the drop-in. The bottle should also be comfortable for the caregiver to hold. Compare this one. How would that feel to hold compared to some of these? This one's not very comfortable. Same nipple on a different bottle, much more comfortable, and other variations. When you're choosing a nipple and a bottle that are appropriate for the infant to be fed, keep in mind that some infants need a narrow base nipple due to poor lip tone and/or an inability to seal to a wide base. Some will gag if the nipple is too long. Some won't respond well if the nipple is too short, and insufficient stimulation is provided along the tongue. Try different nipples until you find what works best for the baby. You'll also see differences in the transition from the narrow tip of the nipple out to the base. This one has a gradual transition. This has an abrupt transition. This one also has an abrupt transition. This one is a narrower base. But again, look at the length of the nipples as well. Again, choose a bottle that feels comfortable. This combination may work well for one baby with a nipple with a gradual transition, fairly straight-sided bottle. Here's the drop-in bottle with more of a transition there, but a nice place for babies' lips to rest for many babies. One bottle type will not work for all situations. We're generally going to use 4 to 5 ounce bottles, although for a younger baby we might choose a smaller one. There is at least one good 2 ounce bottle out there on the market, plus the little Volufeed type bottles, which are usually about 2.5 ounces. Choose larger infant bottles for older infants if they're needed. But most important is probably selecting a bottle that's comfortable for the caregiver to hold. With the nipple, again, consider the shape. One type is not most like all breastfeeding situations. Consider texture. Some are softer, some are firmer. Use one where the baby's lips can maintain an open, neutral posture. And consider the flow rate. A slower flow rate is often best. Now we're going to watch a video that tells us and shows us what baby-paced bottle feeding looks like.
Hi, I'm Victoria Vicelli, IBCLC over here at Emerald Doulas, and I'm here with my friend Cameron today to teach about paced bottle feeding. I'm going to be speaking really clearly about what it is that I'm doing for any visually impaired people who are tuning in today. So when we talk about paced bottle feeding is important for all babies because it helps them eat a little bit more slowly and develop all their oral facial muscles. So instead of giving a bottle to a baby who's laying flat in your lap in the crook of your arm, which is kind of how we see it in the movies, we're actually going to take that whole system and turn it up so that Cameron is sitting up in my lap and I'm using my hand to support his back and neck so that he is well supported and sitting up. You'll also notice that I've got pillows around me so that I'm really comfortable. We want a paced bottle to take about 10 or 15 minutes, so I need to be nice and comfortable so that I'm patient with him and waiting here. So the other reason why we do this is for people who are choosing to breastfeed, that then babies can go a little bit more easily from the breast to the bottle because the flow is a little bit more similar. So what I'm going to do is I've got Cameron sitting up in my lap, and I'm going to tickle his lip just like we do with breastfeeding to get a nice big mouth. Got a nice big mouth, and let's see, Cameron, can I have a big mouth? There we go. And now I'm holding the bottle perpendicular to his body, so that the milk is filling just the tip of the nipple, but not necessarily the whole base of the nipple. This way, he is actually doing the work to draw milk towards his mouth instead of gravity doing the work for him. This is a slow flow nipple and a slow flow bottle, which I do recommend, but it's more about how we give the bottle than the bottle that we're actually using. Oh, you're doing such a good job sucking, Cameron. So now I'm actually playing a little bit of tug of war with him. I'm actually pulling back just a little bit. See, I'm holding the bottle like a pencil. I recommend a bottle that's comfortable for you more than a bottle that looks, smells, was marketed as a breast. What is better is to look for a slow flow nipple and one that fits your hand pretty comfortably. So now I'm tugging back just a little bit so that he has to work to draw the milk out of the bottle and into his mouth, as opposed to tipping him back and letting gravity do all of the work. Then I'm going to sit him forward for a second and let him just suck on the edge of the bottle without any actual milk in the nipple of the bottle. This way he takes little breaks like we get between letdowns and slows him down. I don't know about you, but I don't do my best eating when I eat really, really fast. And babies don't either. So we want this bottle to take a little bit longer so it hits their stomach a little more slowly. They eat a more reasonable amount, and they don't get quite as much upset tummy. So now I've tipped him back just a little bit to let him have a little bit more of this bottle. And I've put more milk in the tip of the nipple. And I'm playing a little bit of tug-of-war with him. All right, Cameron, I think that is enough for now. Thank you so much for tuning in.
Okay. Not everybody's going to need to use that tug-of-war technique she used, but it works well for babies. I particularly like that video because she showed you tipping the bottle down to let the baby take a little bit of a break. Okay. When we position the babies, we like them upright most of the time, but sometimes we're going to use sideline. It's not as commonly used, but it is occasionally helpful. One particular case might be a baby with laryngomalacia who's having trouble, and the sideline position with face feeding can work very well. And most of those babies are just going to have to outgrow that, so mom needs to learn how to feed them. So the baby paste bottle technique uses neutral gravity versus a gravity flow because the breast is not a gravity flow system. It minimizes air swallowing. It's important to keep the bottle horizontal or level or parallel to the floor. We want to invite the baby to take the nipple versus just kind of screwing it in. As you see this clip from the video, she touches the baby's lips with the nipple, tickles his lips, waits for the baby to open his mouth and invite the nipple in. That assists the baby to take a better mouthful of the nipple, and it increases acceptance of the bottle by the baby. How can you help baby pace bottle feeding? You can allow the baby to control the pace. You may need to teach him to pace himself at first. That would be one of the things you might do with tipping the bottle down to let him take a breath. Don't push the baby to finish the bottle. When he stops, stop. Let him take what he tells you to do. Follow the baby's cues. You can let the baby stop to burp, and then consider switching sides from one arm of the caregiver to the other to help develop that binocular vision. When we talk about newborn stomach capacity, there are several ways to look at it. One is the physiologic capacity. That's the amount that the infant can comfortably ingest in a feeding. Then there's the anatomic capacity, which is the amount the infant's stomach will hold at maximum fullness. That newborn stomach in the first 24 hours is much less compliant. It has a decreased ability to relax at birth. And regurgitation will occur with overingestion, or as I like to call it, they give you back a refund. By day 3, there is decreased gastric tone and increased relaxation. So that tummy begins to accommodate increasing amounts of whatever is in that bottle. What does the evidence tell us about what amount is a newborn stomach able to comfortably accommodate in a single feeding? This example compares the amount the baby takes to the size of a cherry. The small amount in the bottle is 1 to 1.5 teaspoons. On day 3, they compare it to a strawberry here, which is 1.5 to 2 tablespoons. Okay. At 1 week, they're comparing it to an egg, holding 3 to 4 tablespoons. And at 1 month, they're saying 5 to as much as 10 tablespoons, although I very rarely see too many babies taking that much in a month. But it's 2.5 to 5 ounces if we translate from tablespoons to ounces. This is all the milk needed for feeding. What are the implications for any bottle-fed infant? Breastfeeding is the human baby's norm. The human infant can maladapt. They may do that to control flow. They may overfeed while they're meeting their non-nutritive sucking needs. And some of these adaptations appear to have systemic consequences. The flow rate from the bottle matters. Use of baby-paced bottle feeding is likely to result in less overfeeding, therefore less overweight and obesity. We see less reflux. We see better oral muscle development, stronger facial muscles, better speech and development and articulation, because baby is using the muscles of the mouth more like they would on the breast as they are designed. And it promotes a stronger maternal-infant bond. In summary, we want to make sure we use an upright position. We want to simulate the breastfeeding latch-on. Place the nipple to the nose or the upper lip on the philtrum, that skinny little place in the center of the upper lip. When the baby responds by rooting or opening wide with the tongue down, place the base of the nipple on the lower lip and kind of roll the nipple into the baby's mouth. And observe the baby's response. If baby needs a little help regulating the suck, swallow, breathe, tilt the bottle down or to the side of baby's mouth for a moment. Let baby catch up. Notice the baby's cues. We want to instruct parents to watch the baby for obvious signs of distress, such as gagging, choking, coughing, or sputtering. We also want to look for more subtle signs of distress, clenching on the nipple, increased drooling, nasal flaring, and aversive behaviors such as tense or big eyes or facial expression, head or arm or leg movements, or finger or toe splaying. Remember, when that baby holds up that hand with all those fingers up, that stop sign is universal. Even newborn babies can tell you stop when they're in distress. So let's shift the paradigm. We want to simulate normal feeding. We want to consider behavioral reinforcement related to flow rate and feeding technique. We want bottle-fed infants using evidence-based feeding techniques, which increases airway production and decreases the negative effects related to maladaptive feeding behaviors. When we're educating WIC participants, we can explain the technique, we can show them how to hold the bottle, and we can reinforce their education with the handout. Any questions?
We've got a few questions that came in. So the first question is, won't the baby be swallowing air in if the bottle is held horizontally?
And the answer is no, because when the bottle is held level, there's gravity is not shoving the milk through. Air is lighter than the fluid in the bottle. It's going to rise to the top. It's going to float to the back of baby's mouth and then out baby's nose.
Thank you. So the second question that came in is, how does baby-paced bottle feeding cause better oral muscle development and articulation?
And most of that comes from the way the mouth muscles are. Because the baby's not fighting gravity, he uses all the muscles of his cheeks, his tongue, his lips, more like a baby would do at the breast. And that helps him learn how to. When babies are bottle fed, the bottles are held horizontal, gravity is shoving it in their throat, they may do a lot of things like tongue thrusting, not really developing all the muscles in the cheeks because they are they don't have to work for it with the bottle when it's like that. So this makes the baby work a little bit more for it and have a more natural development of the mouth.
Thank you. Another question that came in refers to Mother's Days being already so busy. And so the question was, because of that, won't this take longer and create more work for the mother? How long really does each bottle feeding take?
And it shouldn't take any longer than it should. We've always said that bottle feeding should take about 20 minutes, sometimes a little bit less. Frequently, when the baby is chugging it down because the bottle's on an angle and the stuff's just pouring out, often with a fast flow nipple, they're just taking a very fast feeding that's not healthy or safe for them. This puts it more normal. I've never had a mom complain that this took longer. Usually it's just the whole feeding is so much more comfortable for both the caregiver and the baby that it feels right. And no, it doesn't add to the day. And we have less fussiness in the baby to cope with after the feeding, which also makes mom's day a little easier.
Great. And I have one more question that came in. You mentioned that when babies are feeding, they can maladapt if the feeding is not done correctly. And the question here is, what kind of systemic consequences can occur when those babies maladapt? Okay.
Starting, as I mentioned before, with tongue thrust. It can cause a whole lot of, it can cause future dental issues. It can, because the shape of the mouth adapts to the bottle instead of to a more normal pattern. It can also, another systemic response is reflux, because the babies take the overfeed, and that can cause distress, and they can show signs of reflux. There's plenty of babies out there on reflux meds who probably just need to have their parents taught how to feed a bottle more appropriately. Would solve that problem. Another systemic response is constipation. Overfed babies are more likely to be constipated. And we hear complaints about, oh, the baby's getting constipated on this formula. We need to change the formula. Well, often what we need to do is change the volume of the feeding and the way the feeding's being offered. And that problem just disappears.
And it would seem that the ultimate systemic consequence of overfeeding would be obesity, overweight, and obesity.
Absolutely.
We have no more questions. So thank you very much. And thank you to our listeners for listening today.
Thank you. Have a good day.